Before the 1960s, mental health institutions were in abundant use in America due to the lack of treatment for mental illnesses previously thought to be incurable. Throughout the nation, psychiatric wards utilized ineffective treatment methods and a multitude of medications to treat mentally ill patients. In 1963, the Community Mental Health Act was signed into law by President John F. Kennedy, gradually transferring resources from large mental asylums and psychiatric wards to community-based mental health centers. This act mandated over 1,500 new community-based mental health centers, effectively educating the public on mental health, providing inpatient and outpatient services, emergency responses, and temporary hospitalization. This shift from institutionalizing mentally ill patients to treating them near their homes contributed to the increase of outpatients being treated and cured of mental illnesses, such as depression and anxiety. Because it required a system such as community mental health centers to be an effective type of treatment, Dr. Aaron T. Beck's comprehensive psychotherapy called cognitive behavioral therapy, or CBT, could now be initiated. The unique techniques in CBT impacted the Mental Health Care Society because Dr. Beck utilized self-evaluation, where the subject is able to discriminate their negative and self-demeaning thoughts from positive ones. Self-evaluation, along with the reiteration that the patient and therapist are equal and neither is inferior, made communication between patient and therapist easier, allowing the patient to make progress in curing or learning from their mental disability.
We'll work together to try different things. You come back each week, let me know how it went, we'll troubleshoot, we'll tweak it, we'll make it work for you in your life, and we'll kind of keep working like that as two scientists collaboratively figuring out what will work best for you.
Also, because of the recently passed act, therapists at community-based mental health centers could use CBT because it required therapy sessions spanning over 4 to 6 weeks, which could not have begun unless the subject was an outpatient, hence not institutionalized.
CBT provided a more effective form of therapy than anything previously presented to the Mental Health Society. Although Dr. Beck studied psychoanalysis for his psychiatric training, he developed theories which conflicted with the ideas of Sigmund Freud, the creator of psychoanalysis, the first type of therapy to treat mental illnesses. Dr. Beck proved his own ideas through his research and experiments. One of the common theories of psychoanalysis, using the unconscious to explore inverted hostility or retroflected hostility of depressed patients, had never been proven. Dr. Beck began to experiment, looking specifically at the differences between the dreams of the depressed patients and the non-depressed patients, as the interpretation of dreams is the royal road to a knowledge of the unconscious activities of the mind. Retroflected hostility or extreme self-criticism was thought to be more abundant in depressed patients. However, the results of Beck's experiment showed more hostility within the non-depressed patients, the first surprise. He continued to research, attempting to explain the results. As Dr. Beck has previously stated, there is still the unconscious hostility, but the way it's showing up in the dreams is that the patient has a need to suffer, and the need to suffer is then expressed in these negative dreams. These dreams are known as masochistic dreams and became the first stepping stone in creating CBT, slowly changing his approach to therapy and his patients' lives. Moreover, his theories continued to develop and started to merge into cognitive therapy. Clinical trials were done comparing Beck's new therapy to medications specifically used for depression. The therapy started to perform better than these drugs. Dr. Beck wrote Cognitive Therapy of Depression, diving into the details of all the theories and techniques he has come to create.
Interventions would be here or not be what they are today if it wasn't for him.
All developments in psychotherapy subsequent to the 1960s resulted from the exchange of ideas stemming from CBT. Eventually, therapies including dialectical behavioral therapy, or DBT, were generated based upon CBT. Marsha M. Linhan, the creator of DBT, found some issues with Beck's therapy. She found that it wasn't for everyone because the therapist didn't have enough time to help the patient learn from their disorder and address the problems brought up by the patient all at once. Linhan developed DBT to be a specific therapy for borderline personality disorder, BPD, using the same method of therapy as CBT, only modifying the process by adding an acceptance stage. Additionally, many studies and clinical trials were done on CBT. The results from these studies have helped improve not only CBT, but different therapies, methods, and techniques used for effective treatment. Therapies like DBT have given an even better resource to those who need it most. In particular, a study in the efficiency of CBT in depression showed that it was optimal over relaxation therapy, supportive therapy, and psychodynamic therapy. For anxiety disorders, CBT proved to be more effective than weightless treatment, showing the growth of CBT in the field of psychoanalysis.
Is the Association for Behavioral and Cognitive Therapies, and there have been entire panels where Marshall Linehan, who's the developer of DBT, is up there with Steve Hayes from ACT and other folks debating on whether or not DBT is CBT, but just like packaged up in different language.
There has been more access to therapy and treatment as the numbers of the mentally ill have decreased. The number of patients in institutions decreased from 560,000 in 1955 to 130,000 by 1980. The difference in numbers shows the amount of people who had access to therapy. To continue, community-based behavioral health care was delivered through government and county organizations, making it accessible to those in need. The organizations included the Schizophrenia Fellowship and the Mental Health Organization. Furthermore, by 1964, 1,800 psychiatric clinics were in use compared to the 560,000 patients that were institutionalized in 1955, also showing a dramatic decrease.
Nonetheless, one might argue that psychoanalysis improved America's mental health care more so than CBT. Psychoanalysis, developed by Sigmund Freud, was the initial type of psychotherapy used before the Community Mental Health Act, proving that mental illnesses are not incurable. Many psychotherapists during this time, before President Kennedy's act, studied psychoanalysis and used it as a basis for their research. Psychoanalysis relied on Freudian slips, or slips of the mouth, and dream analysis to be effective, but did not consider the patient's conscious thoughts or interpretations to given scenarios. To continue, psychoanalysis appeared more attainable to the patient because of their ability to open up at their own pace. The unconscious surfaced through these unforced therapy sessions. Even though the development of psychoanalysis was necessary for the creation of future mental health treatments, it is incomparable to Dr. Beck's CBT. A tremendous leap forward from psychoanalysis, CBT utilized the technique of treating the subject by changing their perception of an anxious or depressing situation to a positive one. CBT made the patient feel that their therapist is their friend, allowing easier interaction and more effective treatment. Psychoanalysis could possibly result with incorrect diagnosis of the patient, instead harming them further. However, it was not discontinued due to the accessible psychoanalysis in mental institutions and hasty diagnosis of patients using psychoanalysis, no matter how erroneous they may be. Eventually, treatment using psychoanalysis decreased when the Community Mental Health Act of 1963 was passed, when diagnosis and treatment using CBT became available in local mental health centers.
Beck explored an unknown world of treatment in psychotherapy. Before his theory of depression, therapists only consisted of psychoanalysts. Without his risk-taking efforts exploring the foreign area, CBT would never have been formed. Throughout Dr. Beck's work, the exchange of his ideas were important to the improvement of CBT. Without feedback or studies done on his theories, his therapy wouldn't be what it has become today. Exchanging data, suggestions, and results from studies were crucial to the growth of CBT. Dr. Aaron T. Beck's therapies explore the science of depression and anxiety, improving the mental health care of America. He developed more effective treatment methods much needed in the mid to late 1900s, encouraging research in the field of psychotherapy. The environment created by his civil treatment has improved numerous lives. Dr. Beck not only believed in the furtherance of therapy, but more importantly, he believed in the happiness of others. One of the points of cognitive therapy is to be humanistic and optimistic and to like other people and connect with other people, but also to be optimistic in your own life.